there's several things that are very important to do to prevent diabetic foot infection. So first of all, you should definitely take all the medications your doctor prescribes for diabetes so that you keep your blood sugar controlled. So you don't wind up having elevations in your blood sugar. You don't wind up with having that damage to your feet, that you don't wind up with having the risk of that infection forming because you're able to control your blood sugar. Another thing to do is to look at your feet and inspect them every day if you're a diabetic, even if your sugar is well controlled, because even a small cut or an abrasion or blister or something that you may or may not feel, or something that you're thinking isn't a big deal, and you kind of are like, okay, whatever, that's just a little nick from when I cut my toenails, can very quickly lead to a more serious infection. Diabetic foot infections can both be mild and serious. And I think the biggest concern that I have for patients that have infections is that they get treated quickly and as early on as they can. Because especially with a patient who is diabetic, who does not have good control of their blood sugar, the infections in the feet can quickly become a big problem. So I have seen patients with just a blister on one week, and the next week they have a bone infection. And obviously depends upon the individual patient, and it can vary. But the take-home point is to make sure you see your doctor as soon as possible if you see anything on your foot that looks like an open wound or that is concerning you for an infection if you have diabetes. Because in the early stages, they definitely can be mild and they can be treated quickly and maybe not lead to permanent problems or loss of a toe or something. But if they aren't taken care of, those things can definitely be, adverse consequences down the line.